There's something happening inside your body right now that most men have no idea about. And if you're going months without ejaculating, this silent process could be affecting you in ways you'd never expect. I'm Dr. Natalia Parker, and I'm going to explain this with complete clarity. You see, this isn't about judgment or telling you what you should or shouldn't do with your body. This is about understanding what's actually occurring beneath the surface when ejaculation doesn't happen for extended periods. Because here's what nobody talks about: your body doesn't just sit there doing nothing, it adapts, it compensates, and sometimes it sends signals you might be completely missing. I've been working with men's health for over a decade, and this question comes up constantly in consultations. Men sitting across from me, uncomfortable, unsure if they should even be asking. But the answers you find online, they're either terrifying you unnecessarily or oversimplifying something that's actually quite complex. The truth sits somewhere in the middle, and it's far more interesting than you think. Let's start with what most people get wrong. There's this idea floating around that if you don't ejaculate, something catastrophic happens. That pressure builds infinitely until something ruptures or breaks. That's not true, but there's also this opposite belief that nothing happens at all, that your body just carries on exactly the same whether you ejaculate daily or never. That's not true either. Your reproductive system is constantly active. Right now, as you're watching this, your testicles are producing sperm. Millions of them, actually. Your prostate is generating seminal fluid. Your seminal vesicles are contributing their portion. Your body is maintaining this entire complex machinery, whether you're using it or not. The question isn't whether the system keeps working. The question is, what happens to all that production when there's no release? Here's where it gets interesting and where most explanations stop too soon. When ejaculation stops, your body doesn't let things pile up infinitely. That would be dangerous. Instead, it has this incredible adaptive mechanism that most men don't even know exists. Old sperm gets reabsorbed. Your system essentially recycles what isn't used. The cells break down, the components get reintegrated into your body. It's elegant, really. Millions of years of evolution created this failsafe so that men could survive periods without sexual activity. But here's what that explanation misses. And this is critical. Just because your body can handle it doesn't mean there aren't consequences. And some of these consequences are happening in areas you'd never connect to ejaculation. Your mood, your energy levels, your ability to concentrate, even the way you experience physical sensations in your pelvic region. Think about your prostate for a second. This small gland, about the size of a walnut, sits right below your bladder. It produces a significant portion of your seminal fluid. When ejaculation happens regularly, that fluid gets expelled. Fresh production replaces it. There's flow, there's circulation, the gland contracts, empties, and resets. But when that doesn't happen for weeks or months, that fluid just sits there, stagnant, accumulating. And stagnant biological fluids rarely lead to anything good. We call this prostatic congestion. It's not a disease. It's not an emergency. You're not going to end up in the ER because of it, but it creates this uncomfortable pressure that men describe in different ways. Some feel it deep in their pelvis, like a dull ache they can't quite locate. Others describe a heaviness in their testicles, like they're carrying extra weight. Some notice discomfort when sitting for long periods, especially on hard surfaces. It's subtle enough that you might not even connect it to ejaculation, but persistent enough to affect your daily comfort and quality of life. And this is just the physical side. What's happening psychologically might surprise you even more, because this is where things get really complex. Your brain treats ejaculation as a reward event, a significant one. When it happens, your system floods with endorphins, which are natural painkillers and mood elevators. Oxytocin gets released, creating feelings of bonding and relaxation. Dopamine spikes, giving you that sense of satisfaction and pleasure. These aren't just feel-good chemicals floating around randomly. They regulate stress responses, mood stability, even your ability to focus and think clearly. They're part of why sex and masturbation aren't just physical acts, but emotional experiences that affect your entire state of being. Now imagine that reward system suddenly stops receiving its signal. At first, nothing dramatic happens. Your brain isn't alarmed, it's not sending distress signals. But over time, something subtle begins to shift. Your brain starts adjusting its expectations. The neural pathways associated with sexual release begin quieting down, becoming less active. And here's the paradox that confuses so many men. People think that going without ejaculation for a long time builds up this massive sexual energy, this unstoppable drive. Sometimes it does work that way, but only for a short period, maybe the first couple of weeks. Your desire might spike. You might think about sex more frequently, but if the abstinence continues beyond that, that energy doesn't keep building forever. It plateaus, levels off, and in some cases, it actually decreases significantly. Men report feeling less interested in sex, not more, less aroused by stimuli that used to excite them. Your brain is essentially saying, if we're not using this system, maybe we don't need to maintain it at full capacity. Let's conserve resources. It's not permanent damage, it's not irreversible, but it is a real shift in your neurochemistry and psychological state. And when men finally do resume sexual activity after long periods, they sometimes notice their desire or response isn't quite what they expected it to be. It takes time to rebuild those neural pathways, to retrain the brain to expect and respond to sexual stimuli. There's something else happening too, something most people never consider until they experience it firsthand. When you don't ejaculate for extended periods and then finally do, that first ejaculation can feel intense in ways that aren't entirely pleasant. Some men describe it as uncomfortable, even mildly painful. There's this pressure that's been building, and when it releases all at once, the sensation can be overwhelming. The semen might look different too. Thicker consistency, sometimes with slight color variations, yellowish tint instead of the usual off-white. The volume might be surprising, much more than usual. Again, this isn't pathological by itself. It's not a sign of disease, but it shows you that something was accumulating, something was changing, even if you didn't feel it day to day. Your body was storing, and now it's all coming out at once. Let me tell you something. This question comes from men in all kinds of situations, from all over the world. Drop a comment and let me know where you're watching this from, because I've noticed this isn't just affecting one demographic or one country. This is universal. Men in relationships who've stopped being intimate with their partners, single men who've chosen abstinence for personal reasons, younger guys trying these internet challenges about retention, men over 50 dealing with medical issues that make sex difficult. Everyone's asking about this, and everyone deserves a real answer that doesn't just tell them what they want to hear. Now, let's talk about what happens to your testosterone, because this is where myths really take over and create so much confusion. Some people claim that not ejaculating skyrockets your testosterone levels. You see these articles online promising that if you just stop masturbating, you'll become this superhuman version of yourself. More energy, more muscle, more confidence. Others say ejaculation has absolutely no effect whatsoever on testosterone, that they're completely unrelated systems. The truth? It's complicated, and it's not what either extreme claims. Short-term abstinence, like 3 to 7 days, can cause a slight temporary spike in testosterone levels. We've seen this in studies. There's a measurable increase, but here's what those articles don't tell you. Long-term abstinence? The effects level out completely. Your testosterone doesn't keep climbing indefinitely just because you're not ejaculating. After that initial week or so, levels return to baseline. Your body regulates testosterone through multiple pathways, and ejaculation is only one small piece of that enormous puzzle. What does change, though, and this is subtle but important, is how that testosterone is being used and expressed. If you're not engaging in sexual activity, your body might redirect that energy elsewhere. Some men report feeling more driven at work, more focused on physical fitness, more aggressive in competitive situations. But here's the catch. And this is where that feedback loop I mentioned earlier becomes really relevant. If your libido starts dropping because of prolonged abstinence, you might experience this weird psychological loop where your desire decreases, which makes you less likely to seek sexual activity, which further decreases desire through lack of stimulation. It becomes self-reinforcing and self-perpetuating. Breaking that cycle isn't always easy. Some men find that when they try to resume sexual activity after months or even years of abstinence, their body doesn't respond the way it used to. Erections might be weaker initially, not quite as firm. Arousal might take longer to build. They need more stimulation, more time, more mental focus to get aroused. This isn't necessarily physical dysfunction in the medical sense. Often, it's psychological adaptation. Your brain has adapted to not expecting that sexual release, and now it needs time to recalibrate, to remember how to respond to sexual cues. Here's what concerns me most in clinical practice, what I see again and again. Men come into my office with complaints that seem completely unrelated to sexual health. They're irritable, snapping at their partners or coworkers over small things. They have trouble concentrating at work. They can't focus on tasks that used to be easy. They feel this vague tension they can't quite explain or locate in their body. And when we dig into their medical history and lifestyle, when I ask the questions that make them uncomfortable, we find they haven't ejaculated in months, 3 months, 6 months, sometimes longer. They didn't connect the two things. The idea never occurred to them. But once they understand the relationship between sexual release and these neurochemical regulators we've been talking about, everything clicks into place. This doesn't mean ejaculation is some magical cure for all of life's problems. It's absolutely not. If you're depressed, if you're anxious, if you're dealing with real psychological issues, ejaculating more often isn't going to fix that. You need proper treatment. But it is a biological function that has ripple effects throughout your entire system, both physical and mental. Ignoring it completely isn't neutral. It's not a zero-impact choice. It's a decision that comes with its own set of consequences that affect multiple aspects of your health and well-being. Now let's address the elephant in the room, the thing everyone's really wondering about, prostate health. There's research, actual peer-reviewed scientific research, suggesting that regular ejaculation might have a protective effect against certain prostate issues. The mechanism isn't fully understood yet. We don't have all the answers. But the theory is that regular flushing of prostatic fluid prevents stagnation and potential inflammation. Fresh fluid in, old fluid out. It keeps things moving, keeps the gland healthy and functional. Does this mean you need to ejaculate every single day to have a healthy prostate? Absolutely not. Does it mean never ejaculating is definitely going to cause prostate problems? Also, no, that would be oversimplifying the research. But the data does suggest, consistently across multiple studies, that men who ejaculate more frequently tend to report fewer prostatic complaints. Less discomfort, less inflammation, lower rates of certain prostate conditions. This becomes especially relevant, critically relevant actually, as you age. Younger men have prostates that are more resilient, more forgiving of neglect. Your body can handle a lot when you're 25 or 30, but after 40, 50, 60, that gland becomes more sensitive to everything. Benign prostatic hyperplasia, which is non-cancerous enlargement, prostatitis, which is inflammation, even prostate cancer risk factors. All of these become real considerations that you need to think about. And while ejaculation isn't a treatment, isn't a guarantee of perfect health, it appears to be one factor among many that contributes to long-term prostatic health and comfort. So what's the practical takeaway here? What should you actually do with this information? If you're choosing not to ejaculate for personal reasons, for religious beliefs, for philosophical convictions, that's completely valid. I'm not here to judge your choices or tell you how to live, but you should be aware, consciously aware, of what your body might be experiencing as a result. Pay attention to discomfort in your pelvic region. Notice changes in your mood or energy levels. Be conscious of whether your desire is naturally low, because that's just how you're wired, or whether it's being artificially suppressed by this adaptation we've been discussing. There are things you can do, practical things, to support your urological health even without regular ejaculation. Physical activity improves pelvic circulation significantly. Exercise literally helps flush your system, reducing that congestion we talked about. Swimming is excellent because it engages your core and pelvic muscles. Walking, especially brisk walking, keeps blood flowing to the area. And pelvic floor exercises, Kegels for men, actually strengthen the muscles involved in ejaculation and urination. These aren't substitutes for ejaculation, they don't replace it, but they help maintain function and comfort. Diet matters too, more than most men realize. Anti-inflammatory foods support prostate health directly. Omega-3 fatty acids from fish or supplements, lycopene from tomatoes, especially cooked tomatoes, nuts, particularly walnuts and almonds, leafy greens like spinach and kale. Your urological system benefits from the same things that benefit your cardiovascular system. They're more connected than most people realize. What's good for your heart is generally good for your prostate. And here's something critical that men ignore constantly. Avoid prolonged sitting. If you work at a desk all day, sitting in the same position for 8 or 10 hours, that static pressure on your pelvic region compounds any existing congestion. It's like pressing down on a sponge that's already saturated. Take breaks. Stand up every hour. Move around. Walk to the bathroom even if you don't need to go. Keep blood flowing to that area instead of letting it pool and stagnate. But let's get back to the core question, the one that brought you to this video. What actually happens in concrete terms if you go months without ejaculating? Your body adapts. That's the simple answer. It doesn't break catastrophically, but it changes. Some of those changes are completely invisible to you. They're happening at the cellular level, in your hormones, in your neurotransmitters. Others manifest as subtle discomfort or mood shifts that you might not even recognize as related. And a few men, not all but some, experience more noticeable effects that significantly impact their daily life. There's no single universal response because your overall health status, your age, your baseline hormone levels, and your psychological state all play enormous roles in how your body responds. A 25-year-old with high testosterone and no health issues will experience abstinence differently than a 55-year-old with metabolic syndrome. Context matters enormously. What I want you to understand, what I need you to take away from this, is that ejaculation isn't a medical necessity like breathing or eating. You won't die without it. Your body won't shut down. But it's also not completely irrelevant to your health. It's not something you can just ignore entirely without consequences. It's woven into your hormonal regulation system. It affects your mood chemistry through neurotransmitters. It influences your prostatic function and comfort. Treating it as either critically essential or completely meaningless misses all the nuance of how your body actually works. If you're experiencing discomfort, real physical discomfort in your pelvis or testicles, if your mood has shifted noticeably over weeks or months, if you're feeling that vague pelvic pressure or heaviness we discussed, these might be signals worth listening to. Your body communicates through symptoms. It's trying to tell you something. And dismissing those signals because they're not life-threatening, because they're not sending you to the emergency room, means missing an opportunity to improve your quality of life significantly. On the other hand, if you're perfectly comfortable, if you're not experiencing any negative effects whatsoever, if your mood is stable and you have no physical complaints, then extended abstinence might not be causing you any issues at all. Every body is different. Every nervous system responds uniquely. There's no single answer that applies to every man in every situation. What I see too often, what frustrates me most, is men suffering in silence because they're embarrassed to discuss this. They think it's not a real medical issue, or worse, they convince themselves that discomfort is normal, that it's just part of being a man, something they should tolerate without complaint. It's not normal. Discomfort is your body's way of telling you something needs attention or adjustment. The goal here isn't to pressure you into any particular behavior or frequency. That's not my role. It's to give you information, real scientific information, so you can make informed decisions about your own body based on facts rather than myths or internet folklore. If this information makes sense to you, if you're someone who values clear, science-based explanations about men's health without judgment or agenda, subscribe to this channel. Because what we do here is break down exactly what's happening in your body, the real mechanisms, without fear-mongering, but also without sugar-coating. Just information you can actually use to make better decisions. Your urological health is part of your overall well-being. It's not something to ignore because it's awkward or because you think it's not important enough. It's something to understand, monitor, and support just like any other aspect of your health. And now you have the information to do exactly that.